Hi, this is Dr. John Suber, plastic surgeon, and welcome to Straight Talk on Plastic Surgery. Today's video segment is in response to a question from a viewer who was a former diabetic. She's lost a lot of weight and now does not have to contend with that issue day to day. She wants to know, as a former diabetic, is she a candidate for plastic surgery? The short answer is yes, with conditions. By that I mean, when I see a patient for surgery, preoperatively or at an initial consultation, I'm taking a very detailed past medical history and having a one-on-one discussion with the patient, myself personally, to really get a full understanding of their history. This is why, as an aside, I don't have my nurse do these consultations and then have me come in at the last minute, do a quick exam and leave. I'm the one taking all of that history, getting all that information, because I want to hear firsthand what's going on with you, the potential patient. That aside, issues such as diabetes, high blood pressure, high cholesterol, previous history of wound healing problems, these are some of the issues that can raise my concern a bit as it relates to wound healing. Well, first off, why does wound healing occur with plastic surgery sometimes? Well, first off, it can occur with any surgery. But with plastic surgery, we are making flaps. That is, we are taking vascularized tissue, elevating it up, rearranging that tissue, removing excess, and then re-establishing continuity with that tissue plane. What does that mean, right? Well, that can be a tummy tuck, where we elevate the tissue up, and by doing so, we are temporarily compromising blood flow, because when you have a piece of tissue, blood flow is coming in from all directions. But when we make an incision and peel or elevate that off the deeper tissue plane, the only blood flow is coming in from out under the ribs. That's why in a previous video you've heard me say that with a tummy tuck abdominoplasty, that's the largest randomized flap that we as plastic surgeons perform. That blood flow is relatively random. We elevate that tissue up, tighten the muscle, cut off the excess, pull down, and close. Now granted, that's an oversimplification, but we're making flaps. Flaps are also made with the arm when we elevate and remove tissue there, breast lift, thigh lift, lower body lift, and even face lift. All these represent flaps, and as such, wound healing risks are higher in that type of procedure when compared to an incisional approach. Someone is getting their appendix out, they have an incision in the skin, we part that tissue, go in, take out the appendix, come out and close. With plastic surgery, it's the skin and subcutaneous tissue itself that is often being manipulated. So that is in a situation where a flap is created, and with flaps, increased risk of wound healing problems occur because of the temporary alteration in blood flow. Sorry for that mouthful, but I hope that helps you understand a bit of that. Now, with certain medical conditions like diabetes, the blood flow that is present is going to be affected, and it'll be challenged or tested when a flap is created. So with the abdomen, the blood flow comes out from under the ribs. These vessels can undergo changes with years of medical conditions such as high blood pressure, diabetes, high cholesterol. Suffice to say, you can have a narrowing of these vessels or constriction of these vessels as plaque may build up along the walls of the artery. Or with diabetes, many people are familiar with having wound problems in the feet due to poor blood flow. Well, that can be tested, an issue that can be tested with flaps as well. So their risks are higher than someone who has never had those medical problems as it relates to wound healings after flap procedures. Now, within the subset of diabetes, for example, the insulin-dependent diabetic is oftentimes going to be a slightly higher risk than the non-insulin dependent. That is not universal, and that decision would have to be determined, evaluated by your internist and your plastic surgeon prior to surgery. But as a general rule, I find that insulin-dependent diabetics have a little higher risk than the non-insulin dependents. That may be, in fact, because the patients who are insulin dependent have had diabetes for a longer period of time. It may be what's called juvenile or child onset diabetes, and that may be part of that issue. But diabetes is an issue for wound healing. The longer you've had that diabetes, the longer you may have had changes in the blood vessels that are feeding the tissue we're working on, so that can make the risk higher. But if you have diabetes, don't lose hope, because patients who have maintained good control of their diabetes are lower risk than those that have not. And patients whose issue goes away after weight loss, as in the case of this question, your risk is lower than if your diabetes stayed the course even after weight loss. Beyond that, I'll even say further that your good control of your condition is going to be a portion of the risk to the wound healing after surgery as well. So I'm always going to check hemoglobin A1C, which tests how well the sugars have been maintained over a period of time, usually even if the diabetes has gone away. High blood pressure, high cholesterol, same thing. The better control you've kept that under over the long term, the less risk wound healing you're going to have. But when I talk about people with wound healing overall, let's just use the abdominoplasty tummy tuck as an example. I always typically say that the gastric bypass weight loss population is typically, not always, but typically going to have a slightly higher risk than your non-previously obese patient population. And those that have better control over their conditions while they had them are going to have a lower risk than not, and the shorter period of time that you had to deal with that, the better. So in plastic surgery, it's all about piling the risks in one hand, the benefits in the other, and we weigh it out to see which way we want to go with whether or not to proceed with the procedure. Wound healing problems I think about for at least a month after the surgery, and the diabetics and the former hypertensives and those patient populations I'm following more closely. So in short, diabetics and other people who've had medical problems that can affect wound healing are still candidates, generally speaking, but you need a one-on-one evaluation with a thorough plastic surgeon, well-trained, well-qualified, who's going to address each of these issues, and then bring in your internist or medical family doctor as to partner with him to assure that you're in the best place you can be, so that risk factor of wound is as low as it can be. I could not fail to mention smoking as it relates to wound healing problems. That isn't directly associated with this question, I understand, but I will not operate on smokers when they're actively smoking. In my hands, you have to stay off smoking for at least 3 months prior to me considering a flap type procedure with you. Part of that is to make sure you're quit, and part of it is to reverse the immediate effects that smoking can cause on wound healing as much as possible. As a former smoker, your risk is always going to be higher than someone who's never smoked, but I'm an avid anti-smoker when it comes to my office in plastic surgery. Once you're well healed, if you're crazy enough to want to start back, you can do that, but I'm very aware of that and push that very hard with breast reductions, lifts, bellies, faces, anything I'm concerned about. Now, augmentation was brought up by the young lady who brought up the question. Augmentation, we're not creating a flap really. We're making a short incision, typically putting in an implant under the muscle many times. Either way, we're separating tissue planes, and we're not as higher wound healing risk with former diabetics and the like, relatively speaking, compared to when we do flaps. But with people who've lost a lot of weight, many times augmentation has to be coupled or partnered with a lift of some sort. So implant placement alone, your risk isn't really higher. A lift procedure on the breast, yes. And so hopefully that answered your question. I hope that you'll find that helpful. If I know I gave a lot of information to a fairly straightforward question, so if there are other questions that are brought out by this video, please send them to me. And again, remember the format is email me a question and I'll answer it via video. So thanks so much for your attention today. I hope this helps. Remember, no matter where you are in life, life is good.